Alright guys, time for When AI is Wrong, Pharmacy Edition. This is part 1. First off, can you use Augmentin for Klebsiella pneumoniae BSI or bloodstream infection? It's considered not appropriate, and here's why. First, chat brings up intrinsic resistance to ampicillin. The BLI or beta-lactamase inhibitor, clavulanate, actually restores that coverage, and chat points out that it's generally insufficient. Then also goes on with some jargon about how oral bioavailability is inadequate, IV is more appropriate. Bottom line, Augmentin is not appropriate. This is not true. If susceptibilities show, absolutely you can use Augmentin for Klebsiella pneumoniae BSI. 875 every 8 hours is okay for normal renal function. If you have an improving clinical picture, for example, patient's afebrile, doesn't have a fever, white blood cells are trending down, etc., absolutely you can de-escalate to oral antibiotics. This is for most cases of gram-negative bacteremia. Next, what is the TN-case or tenecteplase dose for stroke? The dose is correct. However, chat says up here TN-case is not FDA approved for stroke, but it is used off-label. It is FDA approved. You're absolutely right! As of March 2024, TN-case is FDA approved for ischemic stroke. Like, why the switch up? Not to use AI to correct AI, but it was actually March 2025. Next, talking about linezolid. So are SSRIs contraindicated with linezolid, the antibiotic? Yes, SSRIs are contraindicated with linezolid, unless absolutely necessary and with close monitoring. Avoid co-administration unless there are no alternatives. If linezolid must be used, SSRIs should be discontinued prior to initiation. Wow. Chat wants you to have two problems: an infection serious enough to use linezolid, and then SSRI withdrawal. Many studies show that you can safely be on SSRIs and linezolid at the same time. The risk for serotonin syndrome is really only present when you're on another monoamine oxidase inhibitor or multiple serotonergic agents. Civox or linezolid is a weak MAOI, monoamine oxidase inhibitor.